the Public Protector's visit to Gauteng hospitals. We now cross live to our reporter Tumaole Mohlaoli, who is at the George Mokhare Hospital in Pretoria, where the Public Protector is right now. You've been on quite a field trip today, Tumaole, with the Public Protector. How has the trip been going so far, and what have been some of the key observations that the Public Protector has made?
A very busy trip indeed, Tammy, and as we speak right now, our Public Protector Advocate Busisiwe Mkhwebane is on site here at the Dr. George Mokhare Hospital. And in terms of her inspection, she's been engaging with officials at the hospital in terms of what challenges they face and what are some of the issues that they have to deal with, particularly in light of the COVID-19 pandemic and some of the challenges that have been facing officials as they try to deal with this pandemic, but also operationally. Now, let me just cross right now and speak to Advocate Busisiwe Mkhwebane. Advocate Mkhwebane, what was the feedback you got here at the hospital?
The feedback I got is that, the acting CEO was indicating that they've managed to change some of the wards of the hospitals to, designate them to deal with the COVID-related issues. But then also they were involved late in the process because they were, designated end of March or beginning of April, and that put them a little at the back, on the back foot. But then also the infrastructure which they have there, the ones they've converted. Well, he's saying the one of, in fact, it's the best ever in the country. I don't know whether that's true, but he was saying that's what they have, because what they have there is that they can have patients who have tested and patients who are still under investigation. They can be separated properly. There's an extraction which is there to make sure that even when you open the ward, you won't be infected with any or with the virus. So I think that's what they've tried to do. Apparently they've converted like 8 wards, 26 beds each, but also there's also wards for isolation. So 4 have been occupied already, and then 4 apparently they'll be handed over on Friday. But the concerning part which we found here is that even in Jubilee, this construction, it's taking so long. We thought that with the lockdown, preparing the infrastructure and everything, things would have been ready by now. But then apparently there's also alternative building technology structure which is built here for 300 beds, and they indicated that actually the money should have been utilized to build additional wards for the hospital, not this kind of infrastructure, because you'd find that after COVID, this won't be utilized. So it's a problem, because then it will have an element of wasteful expenditure. But I think that we will work with the Department of Health to check why this and why continue, because they were engaged. They were not forming part of the needs assessment at first, but then they were involved later, which I think is a challenge. But then on involvement, they should have listened to their needs and also utilize the budget for what is needed here, because that's what the community expect to receive. And another issue which we found, especially from the chairperson of the board, is very critical, especially which is stifling service delivery in hospitals, the issue of procurement. Because the CEO has a level of, or in fact there's a threshold which he can procure for goods, but then when the goods are above 500,000, then the province is the central procurement, which I think it can't work for the hospitals. There's equipments they've procured which they need, which are critical, and apparently it's been years they are waiting for those, and the clinician as well was, or the head of clinical department was even indicating that there's a machine which they needed, especially in the hospital, which can kill the germs or the bugs, but it takes ages to receive something like that. So I think we will work with health and try to improve on those, check what is the role of the board, what is the role of the CEO. But if you have somebody like a CEO who has a lot of experience in public service, why can't they be given additional responsibilities? But then also I must indicate that the engagement here will help us to resolve challenges which are faced by all the hospitals in the country. But we will still see. We will sit down with the minister, the MEC, and we will have to find solutions with them to resolve these issues for the benefit of the public. But I think the more they work with the management of the hospitals, the better. And the issue of that child who passed on, we will also investigate that. We will write and request all the documentation and the explanation from the CEO why the family was not informed on time, because that's one of the key issues which we would want to get from them. And I indicated as well that being the public protector as a constitutional institution supporting constitutional democracy, we are here not to police them, but we are here to discuss with them, find solutions together. And our main aim is the provision of services to the public. So I think this, what we're seeing here, is kind of better off. It's not the best than what we saw in Eastern Cape. I think we need to just indicate that at least it's promising. Maybe more can, or better things can be done.
Public Protector, the issue when you speak about challenges around PPEs and other equipment, of course the story dominating the headlines would be the issue of Gauteng Health MEC Dr. Bandile Masuku being put on special leave over the allegations of investigations into whether there has been irregularities in procurement of PPEs and so forth. Now, having seen for yourself on the ground what the challenges that are faced when PPEs don't reach the people that need it the most, what does that speak to when you think about it?
I think that is at the center of us investigating the procurement, because procurement is centralized. The CEO has nothing to do with that, and they depend on the province, and they need to just go to the warehouse to collect stock for the PPEs. But then I think in our investigation, which I said is an own initiative investigation, we'll have to check as well who are involved in those. It's not only PPEs, but then even structures like this. Why continue to build a structure like this which won't be utilized? Because, I mean, some of the professionals here are saying such structure won't be utilized going forward. What we would have wanted is build more ICU permanent structures, build more or improve the hospital, and increase the capacity. But then if you continue to build when you have appointed this company, why? What is the motivation? What is the reason behind that? So I think our investigation will have to uncover that, and we'll see. Because another issue is the issue of the capacity. Where are you going to get the number of employees you are going to be deploying there? I mean, in Jubilee, we've seen even here 150 contract workers. Why contract workers? Why not employ full-time capacity? I think we were supposed to use this opportunity as well to increase the number of health workers, but besides that, also how they are paid or paid well, but also the process which they follow to even employ permanent structures or at a certain level still is centralized. So that's where we come in. We'll have to work together to improve and change that, if possible, decentralize. Because if you have a CEO who's at that level, having expertise, they can then run with things. Then you wouldn't find the public having been to be affected by issues relating to service delivery, and as well the health workers. I mean, if a health worker is requesting tools of trade and they take years to procure or to provide, I mean, you become demoralized. How do you serve the patients with love? I mean, I think if people come to the hospital, they would want to see a happy health professional or health worker, and I mean, automatically you will be assisted with love, with care. You can heal quickly. I think those issues need just to be taken into consideration. But again, hence I'm saying, we are saying to the department, we'll be saying to the department, the minister, let's work together, because you might not pick up certain issues, but we are here to just uncover those, bring solutions, and our reports are there not only for this current administration. Years to come, when you implement those reports, they will assist generations to come, because we are remedying, those systemic challenges which the country is facing.
Thank you very much. And Dr. Richard Lebete, what are your views in terms of the Public Protector's visit here? How do you feel, and what were some of the issues that you wanted to raise with her?
If I was visible beyond the mask, you'd see all smiles. And I must say I'm very glad that this happened. But I'm happy that we were not only visited by the Public Protector. In the past 2 weeks, we had 2 very serious visits by the Office of Health Standards and Compliance and by a team that is selected by the Minister at national level to come and look into issues around here. Now, this hospital, it's a hospital that is on the periphery of it all. But the demands on this hospital are very excessive. The hospital is old, the infrastructure challenged, the people have grown, the numbers of people, population has grown much lot around it, and much is expected out of the hospital. We have a hospital that serves a community that is disadvantaged financially and otherwise, that have expectations and demands of the hospitals. Expectations in terms of employment, in terms of economic activities, and if we don't do things right, then we are all done. Now, these visits and investigations are the ones that are going to look at the challenges that we have, and if they go by their weight, then they'll be illuminating some of the challenges that we have. It will give us a chance to fix those challenges. And I foresee this hospital going to another level in time to come. Some of my colleagues are worried that this hospital is having so many visits of the persons that are supposed to be taking you to task. We, the management around here, is not, because they appreciate this. They see this as a chance of turning around. And this is the feeling of the hospital. Thank you.
Thank you very much. Well, that is the latest here from the Dr. George Mkhwebane Hospital. And as you've just heard for yourself, Tammy, this was an overall visit where the Public Protector got to get feedback from those at the front line of the fight against COVID-19. So with that, it's back to you in studio.